myself diagnosed with POTS, postural orthostatic tachycardia syndrome. I had to go through the whole rigmarole. I went for a tilt table study, which is a pretty crazy test. You get strapped to a bed and they crank you up and while they're monitoring all of your vital signs, and they want you to pass out. And if you don't do it on the first time, then they crank you down and basically give you speed, adrenaline, do it again and see if it's worse. This was a very yucky test. I kind of passed out and threw up. It was not a fun thing, but I got the diagnosis. We need to have fun. We need to laugh. We need to giggle. We need to dance. We need to do fun things. Play pickleball, whatever it is for you. We've got to play. And when you're playing, enjoy the play. Try to let go of all the noise. Let the lines down for a bit. They'll be there when you're back. Just really try to enjoy that. Enjoy that fun. Enjoy your life and try to figure out what's fun for you and what you like to do.
Welcome to the Inspired Living with Autoimmunity podcast, the podcast for high achievers who want to stay sharp, focused, and full of energy despite their diagnosis. With your host, National Board Certified Functional Medicine Health Coach, Julie Michelson, where Julie helps you take your power back from autoimmunity. And now here's your host, Julie Michelson.
Welcome back to the Inspired Living with Autoimmunity podcast. I'm your host, Julie Michelson. Today I'm joined by Dr. Kelley. Since the beginning of her medical career, Dr. Kelley continually asked questions about health, longevity, and healing that conventional medicine didn't answer. Seeking those answers, she began studying functional medicine to complement her traditional medical studies. Utilizing this multidisciplinary approach, Dr. Kelley has been at the forefront of integrative medicine, devoting her career to treating patients in a highly personalized manner that focuses as much on overall health and wellness as it does on specific issues and diagnoses. In today's conversation, we're talking about POTS, postural orthostatic tachycardia syndrome, as well as immune system challenges. Dr. Kelley shares how an integrative approach that includes addressing lifestyle can allow for true healing. Welcome to the podcast.
Thank you so much for having me.
I am so excited for this conversation. But first, I want to know a little bit about your journey. I want listeners to get to know you a little bit. Share whatever parts you would like, but especially, I always love hearing what inspired people to transition to functional medicine or integrative medicine. And of course, anybody with a healing journey of their own, we would love to hear a little bit about it.
Absolutely. Yeah. I was one of those weird little kids who wanted to be a doctor. So I kind of always knew that is what I wanted to do. And somewhere along the lines in college, I started to feel really tired. I would get really winded. I was, very athletic in high school, track, show choir, all the things. And in college, I couldn't do it all anymore. And I actually got diagnosed with asthma, just because I don't think they knew what to do with me and my symptoms. And just they went with the shortest of breath. And so that's kind of where they ended up. And in med school, I started to get more and more issues. I would get really dizzy when I stood up. I'd feel like my heart was racing a marathon when I was just standing there. And it became really hard to focus and concentrate and learn the way I used to even. And in medical school, I actually got myself diagnosed with POTS. So postural orthostatic tachycardia syndrome. I had to go through the whole rigmarole for this. So I went for a tilt table study, which is a pretty crazy test. Yeah. If you've done this, you get strapped to a bed and they crank you up and while they're monitoring all of your vital signs, and they want you to pass out because that is a positive test. And if you don't do it on the first time, then they crank you down and basically give you speed, adrenaline, do it again and see if it's worse. This was a very, very yucky test. I kind of passed out and threw up. It was not a fun thing, but I got the diagnosis. So I tried several different medications along the way to help just kind of get myself through the intensity that is med school and residency. And while I was in medical school, I really started to get more curious about why people were sick. And I was really frustrated that we weren't really being taught to look for the root cause. We were just being taught to look for the diagnosis and then the meds. Here's the med, here's the treatment. And, I would start working with patients and they would have a list of 12 medications, and I couldn't tell if what they were feeling was just a symptom of all of those medications.
Yep.
So I started my own journey, and I decided to go into family medicine, that lifestyle and that opportunity to treat the entire family, but really get to know patients and their, what makes them tick and kind of where they are and who they are, really drew me to that. And in residency, I dug farther and farther, and I got myself into some different conferences. Back in the day, it was the American Holistic Medical Association. So I'm going to age myself a little bit there.
You look 12, so come on.
Yeah, it still was around then. I appreciate it. But that was really my first foray into, there are other people who think like this.
Yeah.
There are other providers who are curious and looking for this and really want to help people get better and really get to the root cause. And then I did some functional medicine training and other things along the way. And then as part of that journey, I figured out what was going on with myself and my POTS.
Yeah.
And I tried several medications for POTS, a beta blocker and an alpha agonist. And it was all these chemicals and things, and it put a Band-Aid on stuff, but it did not fix anything, and it caused its own set of issues.
Sure.
So in that process, I, was able to find out the root causes for me were adrenal insufficiency, burnout from med school, and residency. Weird how that does that. But then also chronic tick-borne infections were the drivers for me. So when I got those things taken care of or into remission in a better spot, my POTS went away. And that journey through my own whole, pathway really honed in on the need to find these root causes and to listen and believe people and understand you can look okay and you can have normal labs, but still be sick, and try to really look for that. And once you start doing that, you can't stop. So
I was thinking that when you were talking about finding, going to the first conference, I'm like, up in the rabbit hole. You can't go back. You can't unlearn.
You can't unlearn it. Exactly. Yeah.
I love, first of all, congratulations and thank you for also using your wisdom to help others. What jumps out at me that I think, like, if in one sentence, what people often don't realize is that their diagnosis is actually a symptom, right? So here, POTS is a big diagnosis, not easy to get, especially, however many years ago you were diagnosed. And you think, oh, there's the answer, but it's like, no, actually that whole thing was a symptom of the other, stressors on your body and your health. And so I love that we forget that sometimes. I obviously, I didn't know that for the longest time, right? And so that whole, when I ran around, I have RA, it's like this doom and gloom label, and it explains your pain and and no, it doesn't actually. It explains, what medications the insurance company will pay for. But, so, I always say, I've said it so many times on the podcast, I don't know why we try to kill people who want to be physicians. I have interviewed so many doctors who, their exacerbation of their symptoms really all came to a head in medical school, because you're not eating well, you're not sleep, it's crazy. But it's worldwide too. It's not even, so glad you made it through.
I am stubborn. I will say that.
That's good. As long as you can, tap the brakes.
Yeah. I mean, there was more than once where I really thought about quitting. For sure. I didn't know if I could make it through. I didn't know if it was worth it.
Yeah.
Even up to the very end, is this worth it?
Yeah.
I'm glad I stuck it out, but it took years to recover from that.
Yeah.
That in and of itself, I was a different person before all of that.
Yeah.
So,
well, we are glad you stuck it out and made it through, for sure. I wanted to kind of start with the basics of, and you shared as far as your journey, there's some kind of across the board symptoms we think of with POTS, but what is POTS? Like, start really like dub it down for us.
Sure. So it is a dysfunction of your autonomic nervous system. And the autonomic nervous system is the part of our nervous system that controls things we don't have to think about, the automatic things. So our heart rate, our breathing, digestion, that kind of stuff that we don't have to think about. It's also, though, our fight or flight and our rest and digest. So those are pretty common sympathetic, parasympathetic aspects that we hear about. And POTS and other autonomic dysfunction, because honestly, it's a big spectrum and they kind of all mush together and there's slight nuances between all of them. But what happens in POTS, when you stand up, when a normal person stands up, let's say, your body's going to compensate for that gravitational shift pretty seamlessly. You're not going to notice it. You stand up, you're not dizzy, you don't think much, you don't think anything about it, but your heart and your body is changing to compensate. So to make sure the blood is still going up to your brain and otherwise. In POTS, that doesn't happen properly. So when you stand up, it's called postural orthostatic tachycardia. So when you stand up, orthostatic, postural, stand up, tachycardia, fast heart rate. So as soon as you stand up, your heart goes really, really fast and doesn't stop. It doesn't do that to compensate that you don't even notice. So it becomes, and it can jump really, really high. Some people will go up to 200 beats per minute just from simply standing up. That's not
Cool.
normal.
No.
No, and that makes you feel horrible. And you can feel it. It thumps, and then you become really conscious of your heart rate, which we're not normally conscious of that. And then you start to worry that your heart's rate, and it can cause anxiety.
Right.
And it's that, and it all just spirals out of control, right? Then you can also develop syncope related to it. So your blood pressure also adjusts for that postural change. And in some people, when you stand up, then it can dump and drop. And so that you get a low blood pressure and you can pass out. And those people, for that aspect of things too, people can hurt themselves. You can fall, hit your head and really kind of injure yourself. So for some people this can become really, really debilitating. Where you can't have a job, you can't go to school, you can't do things because there's this possibility of hurting yourself in there. So there's a lot of symptoms that come along with this too. So it's not just the fast heart rate, but it can cause brain fog. You can't think clearly, you have trouble remembering things, your brain isn't working the way that it used to. Digestion issues as well. It can either be slow digestion or fast digestion. That's that rest and digest bit gets out of whack. Sleep gets thrown out of whack. The list goes on. It's a long list of symptoms that can happen with these autonomic dysfunction disorders in there. But something is irritating the immune system. Something is.
I was going to say, sounds a lot like chronic inflammation and autoimmunity when you start to bring in, the fatigue and the brain fog and the, GI disruption and all the things. And so I don't want to put words into your mouth. We're seeing more and more, listeners, like autoimmunity is on the rise. I mentioned before, we're seeing more young people, college age people come into the clinic with POTS. Looking for help, luckily smart enough at that age, or somebody has guided them to like, hey, let's get to the root cause of this. What do you think is going on? It sounds like in your personal journey, stress, lifestyle definitely played a big role. What is your theory?
Well, POTS has been linked to viruses for quite a long time. There's some work, actually, a lot of work being done by Dr. Grubb at the University of Toledo in Ohio. Even go back when I was diagnosed with it. And and it has been also linked to a lot of tick-borne infections since then too. But originally, that was one of the driving reasons for POTS was a viral infection. So say mono, for example, you could get a mono infection. I don't know if you remember, but there was a pretty big virus that we had recently that kind of swept.
Is it messing with
Um,
immune stuff?
yeah, I think that virus really has played a role in exacerbating a lot of these issues, and it's perhaps related specifically to that virus, but also just kind of waking up these other viruses. I mentioned mono. This is a virus that's pretty ubiquitous. Almost everybody gets it by the time we're out of high school. Not everybody gets full-blown mono from this. It's usually Epstein-Barr virus, but there's a couple others that play a role too. But once you get these viruses, you always have the virus. It's
They're
like
there.
chickenpox, it
Yep.
doesn't go away, right?
Yep.
And so then you get something like COVID, it can kind of wake up that viral microbiome and can set it off. And then when you throw tick-borne infections on top of it, Lyme and Bartonella seem to be the two biggest. And Bartonella is really a vector-borne infection. It's on all kinds of biting insects. There's some evidence with ticks, but there's more other biting insects and cats and things that can also transmit that. But there are some big correlations with those two infections as well. And then you add a couple on top of it, just the increase in toxicity that we've seen over the decades and how that's affected our world and our humans and things too. And so when you couple all those together, it just it's this perfect brew to create these nervous system dysfunctions or autoimmune disease or immune dysfunction, take your pick, all of the above.
Right.
Yeah.
Yeah.
That's my working theory on why all this stuff is.
I am so glad, and I'm glad you added in the toxic burden that we're all working, just it's piled on, and we haven't evolved that fast. We haven't evolved nearly as fast as all of the chemicals around us. So, yeah. So what are your big, I know you have a course that probably by the time this airs, your course will be out. And I can tell we're very aligned with, this is not that model of diagnosis prescription, like, okay, if you have POTS, do this. And if you have a different autoimmune, you do that. And if you want to be healthy, you do this thing. There are things across the board that support all of us. So tell us a little bit about, what are your, I use the word, pillars or framework. What are kind of the non-negotiables for either starting to move the needle to improve health or protecting health for those that are blessed?
Both.
Yeah.
And spectrum for sure. Yeah. So the course that I've created is on healwithcase.com. And this is the groundwork course. This is groundwork for healing. And it's all going back to the basics. And it's the lifestyle support. And these are the things that all of us can start doing right away to start to see changes. And some of them are small little tweaks, and some of them may be bigger changes, just depending on where you are in your health journey. But for me, it really comes down to kind of 4 core basics, and then I get an extra bonus on there. Food and what you put in your body matters. How much you're moving, which is especially hard for patients with POTS, for example. How well you are dealing with stress on there. How well you're sleeping. And then the extra bonus is how well you're detoxing and supporting that.
I love that you call that a bonus. Although they're all, I always say, you can't just pull the thread. They're all interconnected. And so,
often if you help one thing, you help the others. If you help your stress, you can help your sleep.
Yeah.
If you help sleep, you're going to help your stress.
Right. If you're eating well, you're going to, and moving and all the things. So I love that.
I just wanted to create something so that patients could anywhere, anytime, could get really good actionable tips, start making some changes then and there to kind of take their health in their own hands and build upon that. Yeah.
Let's dive. I'm going to just pick one. It's not random because it ties directly into your story. Because I'm not even talking about POTS. There's so many times as I start working with somebody, and typically it's the women, who, at some point it'll come out like, I get dizzy when I stand up, or lightheaded. I get lightheaded when I stand up. And I'm like, oh, well, yeah, already knew your adrenals were taxed. So let's kind of talk about, do you have any either like must-dos or tricks for stress management and kind of just nurturing that the HPA axis, the adrenal path, it just to me, like at some point we have to be kind of pampering our adrenals or at
Yeah.
least attending to them.
Yeah, acknowledging them, right?
Yeah.
For a lot of people, and I would say working moms especially,
Mhm.
there's a background stress that's always happening. There's always something to think about. There's always something going on. So even if you don't feel like you are stressed out,
Yes.
you probably are because you're
Right.
just used to it. You've become nose blind to it.
Yeah.
You're just your new normal, but it's not normal. And then your body forgets how to rest.
Right.
And our bodies are not designed for that. Our adrenal system, our stress system is designed to, activate when we're being chased by that lion.
Right.
But then when the lion's gone, that's what zebras do. Lion's there, lion's gone,
Right.
But we just live here where the lion's just always chasing us so much that we don't even see the lion anymore.
Right.
You know?
Yeah. And there's a million lions, big lions, little lions. Like it's our system wasn't designed for the chronic stress. And I say that all the time. So I'm so glad you highlighted that. People will say, they'll tell me about their life and then they're like, oh, I'll say, well, how's your stress level? Oh, I'm not stressed. And I'm like, well, I am after listening to you, like you should. And you're right. It's because that's a survival skill, right? But we need to exercise the parasympathetic state and that muscle because we do forget. We really do.
Forget, and you do have to retrain your system to actually allow it to relax. And what I don't want to do is create extra stress to make another to-do list, to make
Yeah.
another have to do in order to not be stressed, because that defeats the purpose.
Yeah, I had somebody
right?
literally tell me this week that she just realized she's been meditating for like 10 years, but she's been doing it like to check it off on the to-do list. And she just realized, like, wow, I probably haven't gotten any value from that. Maybe I should find a different tool, or approach it differently. So,
Yeah. And there's different ways for different people. So you have to find out what works for you. But there are one simple way is just to breathe deeply and actually use your diaphragm and try to remember to do that at simple times at a stoplight, for example. Kind of have that trigger. Not adding an extra to do. So we've got to find some ways to really passively start to do that. And then once you do that, you can actively build on some more active ways to reduce that stress. But yeah, we just don't realize it. I think acknowledging it really is one of the first things.
it's not a strength. I don't know when there was the shift, especially for, like you said, a working mom or of like this badge of honor. I'm so busy. I'm so, and it's like, okay, that's sad. We need to get back to a little bit about how we were meant to live. I'm not saying we can't accomplish wonderful things and work hard. But there is something to the play hard part too. And just those little daily incorporations. I'm a huge fan of stacking. And so I love that you highlight, like, you don't need to create an hour routine in your day, but you can breathe while you're at a stoplight or while you're, if you get good at it, really breathing, you can do it all kinds of times.
And no one knows you're doing anything necessarily.
Yeah,
You're just,
it's the best. And then it's a great tool for when you feel, your stress, you can immediately just start breathing, keeps you in control. It's amazing.
Yeah, and we're crummy breathers. We all breathe just from our shoulders. We're not really using our diaphragm. We're not getting our full breath anyway. And so even just learning how to use that full breath can go a long way.
Yeah, amazing. Do you have any favorite kind? I know you're very interested in longevity and longevity medicine as well. And again, to me, it's a spectrum, right? Of like, oh, here's how we create wellness. And then once we find wellness again, we just want to keep up leveling. So do you have any special kind of breathing techniques that you're a fan of?
I keep it as simple as possible. So I just remember 4 and 8 because
Mhm.
I can do that. So I breathe in through my nose for 4, out through my mouth for 8. You know, there are box breathing. I was actually talking to someone about this recently. Box breathing, where you breathe in for 4, you hold for 7, and you breathe out for 8. As a POTS person and as a babesia
That's
person,
a
that
lot.
holding actually made me more anxious.
Yeah.
So I just do in and out, whatever works for you, right? But I can remember 4 and 8. So I breathe in for 4 through my mouth, using my belly, and out through mouth for 8. And I try to do that 4 to 8 times in a row, 4 to 8 times a day. And I don't count. If I don't get an 8, whatever, like that's not the point of it. It's just those numbers. It just kind of, that way it sticks in my brain and I remember to do it. But that's one of the ways I've modified it for me, just personally, because of my POTS history and
Yeah.
babies can cause air hunger. And so too much of that holding actually made me worse.
Makes
So
perfect sense. And I would say even for listeners without POTS, if you have been in that chronic stress state, I have had a couple of really full on type A personality kind of clients who just even doing what 4-7, I'm gentler than you, 4-7 breathing, um, triggered a stress response in them. So I love that you say, really personalize and do your own count, right? Like don't, when I'm working with clients with breathing, I always start with what I feel like is a pretty fast count because I don't know what their capacity is or when the last time they completely filled their lungs.
yeah,
So
sure.
it
Yeah.
is an exercise, and you'll notice over time if you're just incorporating it into your day that all of a sudden it's like, wow, you know what? I count really slow now. That's great. Or like you said, you can play with, if it serves you, some box breathing or any other. I just say always the one that resonates is
Yeah.
is the one to do or to play with.
Exactly. Yeah.
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 Amazing. Do you have, I know food was also on your list. Do you have any, because you take the same approach as I do as far as personalization, right? We are all individuals. But do you have any across the board, everybody should eat X or should avoid X?
Not entirely, because I do make it pretty individualized. I think that the 2 or 3 foods that really affect the immune system the most are gluten, dairy, and sugar. So when it comes to kind of focusing on anything, those are the 3 that I will start with, generally speaking. And it depends on the person. We might do FODMAPs or intermittent fasting or ketogenic diets, depending on what the needs are. But those are the kind of the big 3. And a lot of what I'm dealing with in my clinic is chronic infections. So I'm trying to boost the immune system, not suppress it. And those are the foods that tend to suppress it. So those are the things that we start with to avoid with that. And a lot of it too, I mean, just some of us, a lot of our population just can't tolerate dairy in general,
Yeah.
just from the lactose. But there's a lot of sugar and other hormones and things in it. So it's not my favorite. And then I actually think glyphosate is one of our issues too. It's not just the gluten, but I think it's the glyphosate that people are reacting to.
I agree. It's one of those you can't separate out. I happen to have celiac, but I know so many people who are even people with celiac or really gluten sensitive people who are fine in Europe, right? So it's like, well, it can't, and we do also have a higher gluten content in our, crops grown here in our wheat and intentionally. So it is really hard to separate. And so I'm with you. I definitely think glyphosate plays a huge role. And it's like, well, you can, in my mind, you can't separate the two, at least here in the States. And so, no, no, no.
Yeah.
Just say no. So I love that. So tell us a little bit, is the course fully online? Is it self-paced? How does that work?
Yeah, it's fully online, it's self-paced. There are 5 modules or chapters, each going with what we talked about. And they're about 20 to 30 minutes each of a video, but then there are also handouts and resources and supplement bundles and things that you can do, actionable tips. I mapped out a
Nice.
diet and with a couple weeks of menus and recipes and all of that to add to the mix in there too. So you have tools then that you can use right away. And picking what makes sense to you, what resonates with you, where you are in life and the things that you can add in there. But yeah, there's a module on diet, on movement, on sleep, on stress, and then on detox. And there will be more to come. There'll be deeper dive content into detox, into mold, into Lyme. All of these other things will be up as we get going. But I wanted to start with the foundations and just lay that groundwork because everybody needs that support.
We do.
Right?
And we
Starting with-
often like forget to even ask things like, do you drink water? Or, that sometimes living in this functional medicine world, we forget where people are coming in from. And so I love that you're starting with, it sounds like pretty easy to digest and take action with the foundations. I know I watched a video this morning of, at first we thought it was a joke, and then I realized it wasn't a joke. It was somebody who apparently, produces like food related content on social media, and she was building this amazing, to quote her, like fantastic kids meal or something like that, and it was a foil pan, which is what she started with, filled it with big flour tortillas, filled that with McDonald's French fries. Then she added an entire bag of chicken nuggets, an entire thing of macaroni and cheese, more French fries. Can't even call it cheese, the Kraft singles. It was like, it just kept getting worse and worse and worse. And I was like, the only thing that wasn't white was the fake cheese.
Oh no.
And I'm like, oh my, who would feed that? And it wasn't a joke. And I'm like, this is what's wrong. This is why we're so sick as a country. And so I love that there is a need for foundations. We all can up level and pick that place where we can make one change and get a win and create some momentum.
And even those of us who've been in it for a while, sometimes you just need the reminder. Oh yeah, I gotta do that. Oh yeah, I should get back to that. Oh yeah. And you mentioned, trying to get people to wellness and then how do we keep you well? It's always going back to those foundations.
Yeah.
How are you moving? How are you sleeping? What's happening with your system and how do we help with that?
Yeah. And I love that you said, like, even you and I and all of us in this space, not only maybe, did something fall off that was serving us, but life changes. And so we need to assess on a frequent basis of like, okay, what is serving me? What would serve me better? What do I need to shift? My life is vastly different this year, being in the clinic almost every day of the week versus working from home almost every day of the week. Very different routines. And some of that stuff that was just built into my day, I had to really be intentional to create, newly. So I think that it is important. None of us are beyond the needing to take a peek at what's going on.
Exactly.
Yeah.
Myself included.
Oh yeah.
Here, I gotta get my sleep in order. Like those are constant reminders that we always have to give ourselves.
Yeah. And we learn, like, what's our threshold of sleep. For me is like, it's important for everybody, but I am very aware of how important it is for me. And it's like, I can't get 3 days of bad sleep in a row, or I feel it. It's not good. So
I'm there with you.
well, I love the work you're doing. I appreciate what you're putting out into the world and how you're helping others heal. Where is the best place for people that are listening on the go right now? Where's the best place to find you?
Sure. Our website for the clinic is caseintegrativehealth.com. The website for the coursework is healwithcase.com. We're also on Instagram with Case Integrative Health and Facebook and all those goodies too, where you can connect with us as well. So yeah, reach out. Love to hear from you.
I almost disappointed listeners because they know to lean in to it's for this last little tidbit of what is one step, it could be anything that listeners can take starting today to improve health.
Oh, what a great question. I think we'll circle it back to relaxing and kind of let go. I think trying to play and have fun is a big
Yes.
component of adulthood that gets missed a lot. And, sometimes you have to actually stop yourself and allow yourself to play and have
Yes.
fun. And it's just as much a reminder for myself as it is for everybody else. But we need to have fun. We need to laugh. We need to giggle. We need to dance. We need to do fun things, play
All-
pickleball, whatever it is for you.
Right.
We've got to play. And when you're playing, enjoy the play.
Right. Yeah.
Try to let go of all the noise, let the lines down for a bit. They'll be there when you're back, but just really try to enjoy that fun and enjoy your life and try to figure out what's fun for you and what you like to do.
Such amazing, amazing advice. I cannot thank you enough. I so appreciate all of the gold you have given us today.
My pleasure. Thank you for having me.
For everyone listening, remember you can get the links and the show notes and transcripts by visiting inspiredliving.show. I hope you had a great time and enjoyed this episode as much as I did. I'll see you next week.
Thank you for listening to Julie Michelson's Inspired Living with Autoimmunity. Did you enjoy this episode? Please like, share, and subscribe wherever you listen to podcasts. If you'd like to get a transcript of this and every other episode, just head on over to inspiredliving.show or click on the link in this episode's description. There, you can also find everything we discussed in this episode, including links and information about our guest. You can even send in your questions to be answered by Julie in a future episode. That's inspiredliving.show. Until next time, this is Julie Michelson's Inspired Living with Autoimmunity podcast, helping you take your power back.